is Percy. I will be talking about the problems with tuberculosis prevention. To begin with, we have to know that the tuberculosis prevention, care and control raise an important ethical and policy issues that need to be adequately addressed. TB is an infection disease caused by the bacteria Mycobacterium tuberculosis. TB disease most often affects the lungs but can occur anywhere in the body. It could be spread from person to person through the air. TB bacteria must be inhaled in order for infection to occur. When a person with contagious TB disease coughs, laughs, or sneezes, he releases TB bacteria into the air. These bacteria can remain in the air for many hours. A person who inhales this air may become infected with TB. Some of the things that TB causes are cough, unintentional weight loss, fatigue, fever, night sweats, chills, and loss of appetite. The first part of TB prevention is to stop the transmission of TB from one adult to another. This is done through firstly identifying people with active TB and then curing them through the provision of drug treatment. With proper TB treatment, someone with active TB disease will very quickly not be infectious. Also, do not spend long periods of time in a stuffed enclosed room with anyone who has active TB until that person has been treated for at least 2 weeks. Use protective measures such as face masks. If you live with someone who has active TB, encourage that person to follow the treatment. Here I put some real cases of TB and how you can prevent active TB. Here I put some
All of the people in this video are real patients who became sick with active tuberculosis disease. Their disease could have been prevented with a simple and safe treatment. They all came forward to share their stories with you because they wanted other people to know how to avoid getting sick the way they did.
I came to work one day not feeling well. I went to employee health and she just sent me home for a normal cold. But then like the next day, I started like having night sweats and I thought, okay, maybe it's more serious. At first I thought I was gonna die. I threw up every day. I was depressed. I was losing weight. I couldn't sleep because if my stomach wasn't hurting, my back was hurting, or I was nauseated all day long.
I went to a clinic to do an exam because I felt very weak. My sight was blurred and I felt dizzy too. And there they did some x-rays on me.
But if you look at this area of consolidation on the right upper lobe, it appears a bit darker and there's more abnormalities at this point.
For about 2 years, I had a problem with one of my lungs.
White would be abnormal, whereas black would be normal.
The doctor recommended a bronchoscopy, and I had the procedure done, and sure enough, it was TB, and it's a fast developing disease once you get it. So I became sick very fast. I developed fever in the morning, drenching sweat. I felt my bones hurt. I just felt like horrible. I wanted to lay in bed and not get up.
At one point in time, I didn't know how I was going to pay my bills the following month because I had been out of work.
It just took a toll. My whole family was distressed. My kids, I was worried that my kids might have had it.
And then when they told me that I was contagious, I'm thinking my daughter, I was home all day with my daughter. And it was like, okay, is my baby going to get sick?
All of these patients had TB disease, a serious illness that kills more than 2 million people a year. But it can be prevented. A TB skin test or blood test can often detect the TB germ in the body before someone is sick and contagious.
Hello, good afternoon. My name is Pat. I'm one of the nurses here.
I'm Stephanie.
Hi, so you're here for a TB test?
Yes, I am.
All right.
I had the skin test done 2 years ago, and then it came back positive.
If you have a positive skin test, it means that you are in risk to have the tuberculosis disease in the future.
They explained to me that it did not necessarily mean that I was going to have TB. It just meant that I was exposed to the bug, and from now on, it was in my body, and eventually I could develop the disease.
And there is a safe and simple treatment that can prevent that person from getting sick.
If your skin test is positive, take, the 2 or 3 little pills that they give you and just tough it out.
I don't think that you have active tuberculosis, okay? I think you have what we call latent TB infection, okay?
I wish they would have told me, listen, this is the important facts why you should be on the preventive, and I strongly recommend that you take the medication. If it would have been explained to me like that, I would have probably been more compliant and did the whole treatment.
I took it as, okay, it was only, I think it was like 3 pills at the time. I took them for like a week, but it made me sick. So I went back to her and I was like, okay, these pills are making me nauseous. I don't want to take them. And she said, oh, okay, don't take them then. It's no big deal. So I said, okay, well then I won't take them. So I stopped taking them.
Unfortunately, all of the patients in this video learned the meaning of a positive TB skin test the hard way. None completed the preventive treatment, and all became sick with the disease.
Okay, year went by. All of a sudden, I'm positive. And
The trouble with TB prevention is that the BCG vaccine is generally used to protect children rather to interrupt transmission amongst adults.